from the World Health Organization. Thank you, Kumudha, that those were very nice and kind words. And thank you, Mr. Kakkar, for organizing this briefing for people who are gathered here. So what I'm going to do is I'll demystify this virus and I'll introduce you to what has been done in the world and what is India doing for preparedness to this virus. So friends, this is not a new outbreak. This has been now there for 1 year. We have completed 12 months into this outbreak. 9 countries have been affected, more than 21,000 cases, more than 8,300 deaths, and we still have a very, very high case fatality rate, almost 60% more in people who are not getting hospitalized still, because there are differences in the capacities of different countries, and I'll walk you through what has been the Ebola story so far. But just to tell you that the West Africa Ebola outbreak has been extremely complex and very unprecedented. It has brought tragedy into the lives of thousands of families, and Kumudha was just giving us an example. And many more have feared the infection, feared getting the infection. So I think the consequences of this virus have been, though intensely observed by countries in West Africa, but the anxiety about this virus has resonated around the world. I wanted to show you a picture and show you what's in the picture and what's not seen in the picture. What you actually see in the picture is a man trying to fan 2 of his children who are sick, and what the picture actually doesn't really tell you is that the man himself is suffering from Ebola. He has just lost his wife and his eldest daughter to Ebola. The twins are serious, they have nowhere to go. There is only one healthcare facility, it's small, and they've been asked to wait. The village has expelled them for fear that they would spread the disease. So really, this disease has taken the world by storm. Nobody had expected such a complicated and such a complex outbreak of Ebola. The year 2014 entirely has rewritten the history of public health because of this disease. And this outbreak is not yet over. It continues. It continues in West Africa with Guinea, Liberia, and Sierra Leone still affected and still reporting new cases every week. I want to just share with you that whenever an outbreak of such an impact happens, the ramifications of it are not just to health. They are political, there are security, there have been a lot of food security shortages, food issues, social, economic, you name it. It's completely an outbreak which has overturned economies. It's brought big setback to countries that were recently out of civil war and conflict. And whatever progress that they had made in health and other indicators, there has been a big setback. And if you just look at the GDP reductions, there's been a 30% reduction in economy in Sierra Leone, 1% in GDP in Guinea and Liberia, and we are not yet talking about this outbreak getting under control. So, these figures keep changing, but what I want to highlight is that West African countries were not just the only countries that got affected. There were many other countries that joined the list, although there were fewer cases, and I'm going to walk you through some of the steps of how this occurred and how the evolution of the outbreak actually happened. Kumudha was talking about a lot of healthcare workers getting affected. Yes, ladies and gentlemen, we have a record of 843 healthcare workers having gotten affected with Ebola, of which 500 have died. So you can just imagine how much the health response capacities particularly in these 3 countries, have further decimated. They initially, to begin with, only they had very limited health system response capacities, but Ebola has really stunted their capacity to deal with the outbreak, not just Ebola, but also other public health conditions. And we find that more people are now dying of malaria, dying of pregnancy-related complications, dying of surgical interventions which are needed but which are not possible because all hospitals are full of Ebola patients. So the Time magazine this year called the person of the year as the Ebola fighters, talking about their, the bravery of these people who went who were there. Some of them were local, a couple of them were belonging to foreign medical teams, other countries who sent and deployed their own healthcare worker staff. But these people risked their lives, they persisted and they sacrificed. So clearly this is being an unprecedented outcome.